Thanks for tuning in to Middlebury College Emergency Action Plan Training for Coaches, presented by Middlebury College Department of Sports Medicine. Today we will review emergency situations and the coach's role within these situations. When an emergency occurs, the athletic trainer will go with the athlete and attempt to notify the family. The athletic trainer will contact the head AT with updates. The head athletic trainer will contact the team physician, athletic director, and head coach. All will proceed to the facility where the athlete was transported. The family will be contacted again with updates. If consent is obtained, an official statement regarding the incident will be released. The head athletic trainer and coaching staff will develop a team debrief. The team will be addressed in a debrief by the coaching staff and team physician and/or athletic director. They will be informed not to speak to the media. The head athletic trainer or designee will complete all necessary documentation. Signs of cardiac arrest include physical collapse, absent pulse, absent breathing, and a loss of consciousness. Coaches should immediately activate EMS and contact sports medicine if an athletic trainer is not already present. PubSafe has an AED and will be notified when you call EMS. There's no need to go retrieve one if you are alone. You can direct someone else to get the AED if one is close by, but it is more beneficial for you to begin CPR immediately. If you are not CPR certified, stay with the patient until help arrives and follow directions given by EMS or the athletic trainer. If you are not actively helping, you should get out of the way and help make sure the rest of the team stays out of the way. Risk factors for heat illness include high BMI, low fitness levels, sickle cell trait, dehydration, and not being acclimated. There are several types of heat illnesses, including heat cramps, heat syncope, exertional hyponatremia, heat exhaustion, and heat stroke. Symptoms of heat cramps include muscle cramps, fatigue, and dehydration. Symptoms of heat syncope include tunnel vision, lightheadedness, dizziness, and fainting. Exertional hyponatremia results from excessive water intake. Coaches and athletic trainers can monitor who's been drinking excessive amounts of water during practice to help determine which heat illness is being experienced. Symptoms include nausea, vomiting, swelling of the extremities, a progressive headache, lethargy, and a core body temperature below 104 degrees Fahrenheit. Coaches should call the athletic trainer if one is not already present. Symptoms of heat exhaustion include cool, clammy skin, paleness, profuse sweating, nausea, headache, and a core body temperature between 97 and 104 degrees Fahrenheit. Coaches should call an athletic trainer if one is not already present. Symptoms of heat stroke include hot, dry skin, irritability, disorientation, loss of consciousness, hyperventilation, rapid pulse, and a core body temperature greater than 104 degrees Fahrenheit. Coaches should activate EMS and contact the athletic trainer if not already present. The athlete needs to be moved indoors or into a shaded area, and their equipment and clothing need to be removed appropriately. Exertional rhabdomyolysis results from the rapid breakdown of muscle tissue from extreme physical exertion, basically when an athlete does too much, too soon, too fast. Signs of exertional rhabdo typically occur within 24 to 72 hours following activity. Symptoms include severe muscle pains and cramping, muscle swelling and weakness, and dark red or cola-colored urine. Risk factors include a low fitness level, a viral illness, sickle cell trait, high BMI, and a hot and humid climate. Coaches should contact an athletic trainer if not already present. Do not force an athlete to continue activity if reporting any of these symptoms. Sickle cell is a blood disorder that causes red blood cells to become misshapen and ineffective at delivering oxygen. Sickle cell is more common in people of color, particularly African American and Hispanic people. Coaches can check this column in the athlete clearance spreadsheet to make note of which athletes carry the trait. Signs of exertional collapse include slumping to the ground with weakened muscles, lying fairly still with no sign of muscle twitching or pain, and musculature looking and feeling normal to the touch. Coaches should activate EMS and contact the athletic trainer if not present, then help cool the athlete down. If an athlete collapses at any time, whether during physical activity or not, coaches should immediately activate EMS. If the athlete is conscious, informed consent must be obtained prior to applying care. This does not apply if the athlete is unconscious. Coaches should call the athletic trainer if not present and begin steps of CPR if certified.
Cold injuries occur mostly in the end of your fall season and beginning of your spring seasons, but can really occur anytime where we have appropriate temperatures or conditions. Chilblain is a red or bluish lesion with swelling, itching, and may or may not also have numbness, tingling, or burning associated with it. Trench foot would be the loss of sensation, again, burning, tingling, numb, blotchy skin, and blisters. Frostbite, the skin becomes hard, white, or grayish yellow, firm, and sometimes shiny and starts to peel or blister in extreme cases. Hypothermia requires you to activate EMS and contact the AT if not immediately present. A mild case would show shivering and inability to perform complex motor function, and it typically has the internal body temperature somewhere between 97 and 95 degrees. A moderate case of hypothermia, you would see a little bit more severe symptoms, including a slurred speech, dazed, sometimes irrational behavior, or even violent shivering. That would require their temperature internally to drop between 95 and 90 degrees. A severe case of hypothermia would show dilated pupils, muscle rigidity, a pale color, erratic pulse or respiratory rate, an inability to walk, and a loss of consciousness. Typically, when this happens, the body temperature drops below 90 degrees and they need immediate attention. Here we have different situations for outside conditions. We have hot conditions, we have cold conditions, and we have inclement weather conditions. As we all know, the ThorGuard likes to go on the fritz from time to time, so the default to that would be the flash to bang rule. For hot temperatures, we go with a wet bulb globe temperature system. Anything below 82 degrees on our wet bulb reading, there are no restrictions in your practices. Anywhere between 82.1 and 89.9, you see a maximum of 2 hours with 4 4-minute breaks. Football is restricted to upper pads only, and they remove all equipment for conditioning. If the wet bulb temperature rises between 90 and 92 degrees, practice maximum time goes to 1 hour with no equipment, no conditioning, and 20 minutes of breaks throughout practice of that 1 hour. So again, that is 40 minutes of practice with 20 minutes of breaks interwoven throughout the practice. Anything that reads above 92.1 on a wet bulb globe temperature system, there's no outdoor workouts until the temperature drops to a reasonable area. For a cold weather policy, anything above 10 degrees, there are no restrictions. No restrictions for practice and no restrictions for games. Anything between 9 degrees and 0 degrees, there's 2 45-minute sessions with 20-minute breaks indoors or 1 hour of continuous practice. For games, you would warm up indoors for an hour before or 10-minute warm-up outside with 50-minute rewarming period, and then normal game breaks with half times and other periods in between play spent indoors. If the temperature drops below 0 degrees, you suspend all practices until temperature increases, and there will be no games played until the temperature rises. Signs and symptoms of a head and neck injury include loss of consciousness following the collision, neck pain following a collision that could be acute and immediate, or it could be delayed even after they may have gone back in. Altered mental status following a collision, abnormal neurological function of extremities, and midline spinal pain all would indicate a head or neck injury. Other things that you want to be aware of is asymmetrical function. Anytime that one side of the body is working differently than the other, whether it's sensational or motor function, it's cause to be evaluated by the athletic trainer. So what should you do if you suspect one of these or you've seen one occur? You need to contact the athletic trainer if they're not present. If it is obvious that a situation has turned catastrophic or severe, you need to activate EMS immediately. Never touch the athlete. Remain close to them and help them calm down and instruct them to remain still. Signs and symptoms of asthma include wheezing, chest tightness, uncontrolled coughing, nasal flaring, inability to speak full sentences, along with abnormal breathing, with prolonged exhale. And again, going through all of your medical forms and checking the checklist, you should know that these are conditions that are pre-existing, and we should be aware and encourage your athletes that have asthma to have any medication pertinent to them with them at practice, at games, at all times. What should you do if you expect an asthma attack? If the athlete is conscious and oriented, contact the athletic trainer if they're not present. If the athlete becomes unconscious, do not wait for the athletic trainer. Activate EMS immediately. Locate the athlete's inhaler if they have one, or have a fellow teammate locate it for them. An airway emergency may occur if an athlete becomes unable to breathe for reasons other than asthma. If this happens, activate EMS immediately. Contact the athletic trainer if they're not present. If you or somebody that you're with on staff is trained in first aid and CPR, check for an obstruction in the airway, perform the Heimlich maneuver. If the airway is unobstructed, open the airway and perform rescue breathing. In cases with diabetic emergencies, it's important to know signs and symptoms of high blood sugar as well as low blood sugar. Hyperglycemia, or high blood sugar, shows a slower reaction time, sluggish or fatigued in nature, nauseated, dehydration might be an issue, fruity breath is often experienced with people who are having hyperglycemic emergency, as well as increased urination. What should you do in that event? Contact your athletic trainer and allow them to handle it. If an athlete is hypoglycemic, that means they have low blood sugar. Mild signs of hypoglycemia include drowsiness, hunger, weak, shaky, or even just nervous. A moderate case would show a headache, impaired vision or speech, and behavior changes, along with mild symptoms. A severe case would show unresponsive, unable to ingest, a loss of consciousness, and sometimes seizure. What should you do in those cases? For mild or moderate cases, contact the athletic trainer if they're not present. In a severe case, contact the athletic trainer after you've activated EMS, but only if they're not present. For mental health emergencies, you need to be able to triage and assess the risk. If there's immediate physical risk or harm in question, call pub safety immediately. If there's immediate mental health concern, call counseling services. If there's immediate mental health concern after hours, call the counseling support line that they have set up, available 24/7, 365. Stay with a student athlete until they're seen by a counselor or police contact is made. The bottom line is make sure that they're safe and there's a warm handoff and the athlete felt that they're cared for.
For the last section of this training, we will go over the venue-specific emergency action plans. All coaches should be familiar with all venues and their corresponding emergency action plan so they can be more effective when serving as a game manager for that venue. Whenever an athletic trainer is present, they will have an AED, splints, and a trauma bag with them. For outside sports, this means at every practice and competition, these supplies will be readily available. For indoor sports, the emergency equipment is typically kept in the athletic training facility during practices, but is readily available during all competitions. When an athlete is injured, the head coach may approach the athlete on field and remain with them until they are transported. Assistant coaches will be asked to manage the rest of the team on the sideline, keeping the team and themselves out of the way and promoting a positive yet quiet environment. There needs to be plenty of space for EMS to access the injured athlete once they arrive. Coaches, we will need your help to get people out of the way and will need you to remain out of the way as well. At Alumni Stadium and Youngman Field, an AT will be on site for all competitions and practices. There is no AED permanently stationed at this venue. Public safety can be called as they have one in each of their vehicles. Contact an athletic trainer if one is not present. If EMS is activated for someone on the field, direct EMS to location A on the map. If EMS is activated for someone in the stands or press box, direct them to location B. Coaches, remember, your role is to calm the athlete, remain flexible in your role, and apply first aid if qualified to do so. At Dragon Track and the women's soccer field, an AT will be present at all soccer practices and competitions, and all track competitions. There is no AED permanently stationed at this venue, but public safety can be called as they have one in each of their vehicles. EMS should be directed to the back of the Arts Center parking lot. Contact an athletic trainer if one is not present. At the men's soccer field, baseball, and softball fields, an AT will be present for all soccer practices and competitions, and for baseball and softball competitions. There is no AED permanently located at any of these facilities, but public safety should be called if one is needed, since they have one in each of their vehicles. Direct EMS to your specific location and contact an athletic trainer if one is not present. At Kenyon Arena, an athletic trainer will be on site for all competitions, and one will always be accessible in sports medicine facility. An AED is located by the main arena entrance and in sports medicine. When activating EMS, direct them to the Zamboni entrance. If the injured athlete is on the opposite end of the ice from the Zamboni, you can direct EMS to the squash lobby instead. Always contact an athletic trainer if one is not present when an injury occurs. And coaches, please remember that your role is to remain with the athlete, to keep them calm, remain flexible, and apply first aid if you're qualified to do so. At Cone Field and in the Squash Center, an athletic trainer will be present at all field practices and competitions, and at all squash competitions. An AED is located in the squash lobby across from the stairs. Direct EMS to your specific location when on the line with dispatch. For indoor sports, an athletic trainer will largely only be on site during competitions. For Pepin Gym and Nelson Arena, an AED is located in the lobby of Pepin Gym. In the natatorium, an AED is located behind the lifeguard tower on deck. There is also an AED in sports medicine. When directing EMS, indicate your specific location. The two red flags on the map indicate the two primary entry points to the building where EMS should be directed. And coaches, again, please remember that your role is to remain with the athlete, help calm them down, be flexible, and apply first aid if you're qualified to do so. When in the fitness center, an athletic trainer may be available by cell phone or in the sports medicine facility. You should always let your athletic trainer know when you have a team lift planned. However, it is not always possible to have an athletic trainer in the building or even on campus during these activities. An AED is located in the stairwell on the second floor of the fitness center. EMS should be directed to the back side of Nelson Arena. In Virtue Fieldhouse, an athletic trainer will be present for all competitions and can easily be accessed in the sports medicine facility during scheduled in-season practices. An AED is located in sports medicine and on the track by the main entrance. EMS should be directed to the front of the athletics complex. Remember, coaches, your primary role is to remain with the athlete, help keep them calm, and apply first aid if you're qualified to do so. At the cross-country course, an athletic trainer and EMS will be present during all competitions. And beginning in the 2020-21 academic year, a trailer will follow the last runner in each race and will be responsible for notifying the medical staff of any injuries on the course. No medical personnel will be present during practices. Public safety and/or 911 should be called if an AED is needed. EMS should be directed to the finish line of the course or to the closest possible location of the injured athlete. At Proctor Tennis Courts, an athletic trainer will be present for competitions when possible. This will be dependent upon how many locations are being used for that match. An AED is located in the Proctor Dining Hall and can also be accessed by contacting public safety. Direct EMS to the tennis courts. Coaches, again, remember to remain with the athlete, help calm them down, be flexible in your role, and apply first aid if you're qualified to do so. At the golf course, an athletic trainer will not be present for any practices or competitions. There is no AED permanently located at this venue. If one is needed, immediately call 911. Please remember, when you call 911, public safety is automatically notified of any on-campus emergencies and will respond in addition to EMS. EMS should be directed as close to the injured athlete as possible. At Reichert, an AT will not be present at any practices or competitions, including Carnival Weekend. Ski Patrol is the primary care provider at this location. Ski Patrol and EMS will be on site for Carnival Weekend. Ski Patrol should be contacted immediately when an injury occurs, and they will be the ones determining if EMS or helicopter transport is necessary. An AED is located with Ski Patrol in the lodge by the main entrance and at the ticket desk. Coaches, please remain with the athlete until they are transported. Help keep them calm and remain flexible. At the Snow Bowl, an athletic trainer will not be present at any practices or competitions, including Carnival Weekend. Again, Ski Patrol is the primary care provider at this location. Ski Patrol and EMS will be on site for Carnival Weekend. And Ski Patrol should be contacted immediately when an injury occurs. Again, they will be the ones determining if EMS or helicopter transport is necessary. An AED is always located with Ski Patrol. At the rugby field and women's soccer practice field, an athletic trainer will be on site for all practices and competitions. There is not an AED located at these venues. EMS should be directed to the Zamboni entrance parking lot, and you should indicate your specific location. Coaches, please remember that your role is to remain with the athlete, help keep them calm, be flexible, and provide first aid if you're qualified to do so. Finally, at the crew launch site, an athletic trainer will not be present for practices or competitions. There is currently not an AED located at or near this venue. Therefore, EMS should be called immediately. Direct EMS to Paddler's Pub, as the launch site is directly next to the restaurant. If an emergency occurs on the water and it is safe to move the athlete to land, do so and take them to the closest point of shoreline. If it is not safe to move the athlete, or you are unsure if it is okay to do so, try to keep them as still as possible until help arrives. Coaches should remain with the athlete, help calm them down, apply first aid, if qualified to do so, and remain flexible in your role.
I have a question. What if I'm not CPR certified? How do I become CPR certified?
If this was not already reviewed in your onboarding sessions, please refer to the athletic director. There are many opportunities provided through Middlebury College to become CPR certified. What if sports med is not present?
If no one from sports medicine is present and an emergency occurs or a situation occurs that you are not equipped to handle, you should immediately contact your athletic trainer or designate someone to do so. If it is an emergency situation, always contact EMS first. And if you're unsure, be on the safe side and contact EMS first before following up with the athletic trainer. What if an official, coach, or even the athletic trainer is the one in need of attention?
If an official or coach needs attention, an athletic trainer should be contacted, or if the situation requires, EMS should be immediately activated. If the athletic trainer also needs attention and you are somewhere where there's not other athletic trainers or medical personnel, activate EMS and default to 911 if you're on the road. Who should call EMS?
It's best that a member of the coaching staff calls EMS. Whether that's the assistant coach or the head coach will depend on the situation. Oftentimes we have situations where multiple people from the stands will call in for EMS, and that can get confusing. We really want to limit the calling to EMS to be from the coaching staff. Do I need to be familiar with all venues?
The coaching staffs are asked to work game management when they're not in season. So you need to be familiar with all venues so you know how to direct EMS on where to go and how to help in those situations.